Lions Club of Tropical Gardens. How may I help?
Hello everyone, and welcome to this discussion with the Lions Club of Tropical Gardens. This morning we're going to be talking to Stephanie Bush, who's a survivor, as well as Dr. Virginia Hobday. She'll be talking to us about the medical aspects of breast cancer, as it is Breast Cancer Month this October. So Dr. Hobday, let's begin with you. Tell us about some of the risk factors as it relates to breast cancer.
Okay, well thank you first of all Lions Club for inviting me this morning. And I must just say that when I first arrived here in 1998, Ms. Kerry Nixon asked me the following month in October to present in Bodden Town. I expected a little group of people, and there were like 300 people there. And then I've been involved presenting every year since then, so that's 22 years. And I don't know how long before that was going, but I must congratulate Lions Club on doing an amazing job of informing and educating the public here. And now as my role as medical director of the Breast Cancer Foundation, you know, I am involved in breast cancer awareness a lot, so thank you. But some of the risk factors are actually quite simple. Age and being female. So that might sound an odd thing to say, but even though we see young women with breast cancer under the age of 40, they're really a small minority, maybe 10 or 15%. Whereas most women, the age as you get older, even into your 60s and 70s, that's where your breast cancer becomes more prevalent. Obviously, being a female makes you more at risk. People do forget that men get breast cancer. I mean, 1 in 8 women will get breast cancer, but 1 in 1,000 men will get breast cancer.
Okay.
But it is a significant issue. Other risk factors, of course, include family history. And one of the myths about breast cancer is that people think if you don't have a family history, you won't get breast cancer. In fact, only 5% of breast cancers are actually genetically linked.
Oh, wow.
So that is, you know, I think people don't realize that. Of course, if you have got a genetic history or first degree relative like your mother, sister, aunt, you are 50% more likely to get breast cancer. And of those people who get breast cancer, the aggressiveness and the need for double mastectomy is much higher. So it is an important factor, but it's not a hugely common factor.
Right. So what are some of the causes?
Well, we don't really actually understand the causes of breast cancer. We know what some of the associations are. I mean, you know, we say that people who've breastfed are maybe less likely to get it. People who started their periods early and had their menopause late, giving them a longer sort of exposure to hormones might be a factor. Smoking, alcohol, obesity, even where you come from. You know, Afro-Caribbean women are actually, unfortunately, at greater risk, especially in the younger age groups. So that, but as the actual, you know, it's an abnormality or a misreading of genetic material that causes mistakes, and then cancer cells start reproducing. So that's underlying it, but all these other factors play a part.
What about the symptoms, Dr. Hobday? What are some of the symptoms of breast cancer?
Well, the one we commonly talk about, obviously, is a lump. And the more people are aware of what their breasts feel like, the earlier they will detect a lump. And that has been proven scientifically. So if you examine your breast regularly, you're likely to discover a lump at a much smaller stage than somebody who never does. And of course, there are a lot of lumps that women feel, and fortunately, the majority of them are not cancer. But they can be anything from a tugging sensation, changes on the skin, the nipple inverting, and obviously a lump. And we often say it's a hard, gritty lump, but we can't be certain of that. So just because a lump is smooth and mobile doesn't mean to say it's not cancer, and it does always need to be checked out. So people often come in saying, well, I don't think it is, I don't want to waste your time. It's never a waste of our time.
Right.
And so, you know, the detection of lumps, any even discharge from the nipple, skin changes, these are all symptoms that should be very carefully checked out.
What are the different types of breast cancer?
Do you know, breast cancer is like the most varied, it's many diseases in one, really. I think a lot of women who get diagnosed are surprised that their cancer is actually, excuse me, quite different from somebody else's cancer. I mean, intraductal carcinoma is the commonest one, but there's another one called Paget's disease. There's lots of multiple types, and within that, there are those that are receptive to hormone treatment, and Herceptin, which is a monoclonal antibody. So all these things will be taken into account with each individual woman, and each individual cancer is treated in a slightly different way depending on its aggressiveness, depending on its size, and depending on its hormonal factors. So no, one size doesn't fit all. And fortunately, you know, the improvement in research and treatment since the 1970s has been quite dramatic in breast cancer. So the earlier we can detect it, the better chance there is of cure, complete cure.
Okay. What's the difference between how men and women are diagnosed and even treated?
Well, you see, men are often present quite late because people don't believe that a lump is anything to do with cancer, and they may just think it's fatty tissue or something like that. So, and they're often a bit embarrassed to come forward, whereas women are a bit more used to having their annuals, and they are more likely to present. So unfortunately, a lot of the men do present late, and therefore there's quite a high death rate in men, and I think that's because they do present late. But again, they present with a lump or skin changes. It's the same symptoms.
If I'm diagnosed, what would you say should be my first step?
Well, obviously going to your primary care physician or whoever your doctor is, and then you would go through a series of diagnostic tests. During that period of time, I always refer patients to support networks, which in Cayman is very well run by the Breast Cancer Foundation. So there's sometimes financial support, emotional support, support with you know, wellness programs, and just to be with people who've been through this journey before.
Right.
That gives them a lot of comfort. So I always do that fairly early on, so that their journey through the diagnostic process, which is actually sometimes one of the most stressful periods. You're waiting to hear what kind of cancer you have, you're waiting to do these scans, if it's spread around the body, those kinds of things. That's a very stressful time, and women need a lot of support at that time. Yeah.
Now, there's some women who may want to seek a second opinion. What do you think about a second opinion?
Yeah, I'm in favor of second opinions. I think it gives people the comfort of knowing that two doctors are saying the same thing. And fortunately, within breast cancer, there's not a lot of variation in treatment, because we try and use evidence-based medicine now, so that these large research studies have proven that this is the best way to go with this, and this is the best. So there's much less sort of individual variation between doctors these days. But I think a second opinion often gives people reassurance, and of course they may have, you know, feel better with one doctor than another. That's just the way that we all are as human beings.
Right.
And so yes, I encourage that.
So what are some of the treatment options with all the new technology and everything that's available these days? What are some of the options available for women?
Well, it very much
and
depends.
Men.
Yes, and men. So it very much depends on their type of cancer and their stage of cancer. So often, if it can be just removal of the lump, and that might be all that they need.
Yeah.
Sometimes it's a mastectomy, but usually it is a combination of chemotherapy and surgery, which can be a lumpectomy or mastectomy, depending on the size and the position and that kind of thing. Sometimes it's even a double mastectomy. And the chemos are very varied as well. Sometimes chemo will take place before surgery, and then after that there will be a period of sometimes radiotherapy, radiation treatment, which unfortunately isn't available, is the only thing that's really not available on the island right now. But some of the treatments can be relatively short these days, and people go to the US, they go to Jamaica, they go to the UK, Canada for those treatments. And then finally, after the chemo, the surgery, the radiation, then comes hormonal treatment. And these are anti-estrogen drugs that oppose the effect of estrogen, which feeds the cancer. And women may be on that for up to 10 years, just as an oral tablet every day. So there are a lot of options, and you know, the survival rate has improved dramatically because of these different options that women have now.
What would you say the pros and cons are, Dr. Hobday, of, let's say, breast reconstruction versus having a prosthesis?
Again, that's a very individual thing, depends on I mean, often it's the surgeon who kind of makes that decision for you.
Okay.
Because if you have to have radiotherapy first, for example, that can change the skin, it makes it much less elastic and difficult to reconstruct.
Okay.
Sometimes it can be done actually at the time of mastectomy.
Okay.
Sometimes later they have to go back and put an expander under the skin to make the tissue big enough to make another breast. So you know, we're very fortunate to have access to excellent reconstructive surgeon in Miami, and he came here to give us a talk one day, and I was absolutely amazed at the different factors that go into making a decision about this. And so he explains all of these to the women, and then they make the right decision for them. I mean, a prosthesis is You know, we have them available for free, and many bras and swimsuits and everything. That can be a very good option for many people, and even if it's just temporarily until they go back and have their reconstructive surgery, because some people need to do it later rather than immediately.
Yeah.
So, you know, I think a lot of older women don't want to go through another surgery. I mean, younger women, obviously, it's part of our makeup, you know, how we feel we are, and so it's very important. I think in the past, you know, everyone thought, well, you know, survival is the most important thing, and what are you really worrying about reconstructive surgery for? But I think it really, you know, nowadays that attitude has changed, and reconstructive surgery is looked at a very much part and parcel of the psychological benefits as well as, you know, physical benefit to women.
Is there anything that I, as a woman, or even a man, that can do to prevent breast cancer?
Well, yes, there are things. Obviously, lifestyle changes are all important. So, not smoking, drinking to a minimum, like 1 drink a day, not having 7 drinks at the weekend, keeping our weight to definitely obesity is related. Exercise has been proven to be a factor. So, having a healthy lifestyle reduces our risk. We can't change our family history, we can't change our sex, and we can't change our age. Right. People often ask about, you know, wearing bras with underwire. Is that likely to cause it? There's actually no evidence for that, but, you know, research is ongoing. Antiperspirants with aluminium and that sort of thing, those have also been given as examples of things that might be causing breast cancer. But again, the jury's out on those, and the majority of the scientific evidence does not show a connection. But as with all cancers, a healthy lifestyle, it doesn't mean you won't get it, but it will reduce your risk.
Sure. Some other questions that I'd like to ask. One relates to the importance of getting your annual mammogram.
That is so important. Both the American Cancer Association and I think that the Canada and the UK have advocated for mammography to be started at about the age of 40. Depending on the family history, and to do it every 2 years until you get to 50, and then every year. The value of mammography is that it may detect something that you can't actually feel.
Sure.
So it's actually, you know, and of course it takes some years for it to become palpable. So having a mammogram that picks things up early is a huge advantage. On the other hand, mammograms are not a perfect tool. And we know that there may be up to 20% of cancers that aren't picked up by a mammogram. So I often say to women when they've had their mammogram, we've told them it's fine, and say don't just assume that's it for another year or another 2 years. You have to keep doing your self-checks.
Sure.
You have to be aware, because some cancers are aggressive and grow quickly, like within a year's period. And also, if you had a false negative and a lump was getting bigger, you wouldn't want to ignore that because you just had a mammogram that was normal 4 months ago. So, but you know, some women are very you know, ambivalent about having a mammogram. They wonder if it will cause cancer because of the radiation. They're afraid of the pain. You know, there's a lot of things around it. So I think getting proper medical advice and not listening to, you know, hearsay is very important, because mammograms can definitely save lives.
Sure. As it relates to mammograms, again, there are many women these days who choose to have cosmetic surgery early in life, or even in midlife. There are women who have what they call dense breasts.
Yes.
Should those women be more vigilant in getting checked?
Yes, I mean, there's no evidence that implants make you more likely to develop breast cancer.
Right.
And certainly mammograms can be done on people with implants. People worry that they can't. If there's a difficulty in seeing it, then an MRI can be used. But yes, I think it is very important for people to be aware, because obviously with an implant, the breast tissue itself is a little more difficult to feel. So rather than not doing it, you should be more vigilant. And of course, a lot of women have very dense breasts, especially younger women. And that's why we tend not to do mammograms in women under 40, because it's actually difficult to interpret them. And as we get older, our breast tissue becomes softer and more loose, and it's easier to read those mammograms. But, you know, an ultrasound can be done as well to determine something. Also, comparing mammograms from 1 year to another can show you if there's been a change, or if that thing, you know, that's been there all the time. And mammograms are, you know, a feature that the equipment is improving all the time. I mean, we have 3D tomograms now. We have 3 of them on the island. And they're almost like an ultrasound and a mammogram combined. And the benefit, of course, is that they're also much more comfortable. They're not as, they don't squeeze as much as the old ones. So women who've had a bad experience, I often say to them, you know, you'll probably find this machine a lot better. And they usually come back and say it was a lot better. So the technology and the pickup rate is improving all the time.
Okay. Any final words, Dr. Hobday?
Well, just that, you know, it's a disease that will affect 1 in 8 women, as I say, so we'll all know women. I mean, I have so many patients and so many friends who've been affected, and I think the awareness, you know, tell your sisters, friends, family, not to be fearful of getting checked, because delay can worsen prognosis. So, as we say, check those puppies, and and you know, don't be embarrassed to come and have a checkup.
Okay, thank you very much, Dr. Hobday.
You're very welcome. Thank you for having me.
So, Stephanie, tell me, how did you discover that you actually had breast cancer?
Well, I was actually, I think, one of those who thought, no, this can't be happening to me. I was actually literally just fixing my blouse at work one day, and my hand brushed in front of me, and I felt something that was about the size of a pea at the time. And I'm like, oh, like, I don't have any family history. I was 29 at the time, so I dismissed it. The lump started to grow, and I went to the doctor. This was April of 2016. I went to the doctor in October of that year for something else. And while I was there, something kind of prodded me to go ahead and discuss it with the doctor. And she ran tests immediately, and I was diagnosed right away, actually.
Wow.
So, yeah.
So how did you react when you heard the doctor tell you that?
I was terrified. I was beating myself up a little bit because I'd let it go for months. And when I was diagnosed, it had already started to spread. It had spread from my breast to the lymph nodes under my arm.
Wow.
So within a very short period of time, it had become very aggressive. So I was scared. I have a daughter. She was 7 at the time. So it was a very, very scary time.
Yeah. What would you say to women who are diagnosed to encourage them to continue?
It is not a death sentence. We have come so far with the treatment options available, and your mindset plays a huge part in this battle. It is very important to be healthy physically with what you eat and your exercise and all of that, but the mind for me was my strongest asset. You have to stay positive. It's not over until it's over.
Yeah, absolutely. What treatment options did you go for?
Well, I was diagnosed with triple-negative breast cancer. There were no hormones involved at all, which was a good and a bad thing. The triple-negative breast cancer tends to be a bit more aggressive. It spreads to other parts of the body very rapidly. So the lump, by the time I sought treatment, it was quite big.
Right.
So I opted to start treatment locally as soon as possible. So I did chemotherapy, and then I opted for a double mastectomy.
Okay.
I did not want to take any chances.
Yes.
Because I knew the reoccurrence for this type of breast cancer was high. So I opted for a double mastectomy. Then I went to Miami for 6 weeks of radiation, and reconstruction followed after that.
Okay. So how were you able to cope during, all of this?
There are days I still ask myself that. I have a very, very strong family unit and friends. I had a lot of support at home. As I said, I have a little girl. Giving up for me was not an option. And my faith, I spent a lot of time in prayer, and my church family was very uplifting. Yeah.
What would you say to women who, let's say, have just been diagnosed? What would you say to them, again, to encourage them to be strong?
Again, it is not a death sentence. You hear cancer and you automatically assume the worst.
Yeah.
You fear the worst. And you don't need to. Oftentimes we are a lot stronger than we give ourselves credit for. So hang in there. It is not over. The options are endless, really, right now with the treatment that is available to us. And you're not alone.
Yeah.
I don't know you, you don't have to know me, but you are not alone. We are in
Yeah.
this together.
Yeah. I was going to ask you as a final question, what do you think about the organizations that exist in the Cayman Islands, like the Lions Club of Tropical Gardens, who is just one of several organizations that are there? What do you think about? What are your thoughts on that?
I think they are amazing. The Lions Club of Tropical Gardens, the Cancer Society, the Breast Cancer Foundation. I have found every year, because I was diagnosed in 2016, every year it has gotten better. They offer so much support and the awareness and the fundraisers that are done for various people who are fighting. Hats off to them. It is amazing. I'm very thankful for all of the services offered.
Yeah.
Yes.
Any final words? Anything you'd like to say to the women who may be listening out there?
You got this. You got this. Believe in you, and don't be afraid to reach out, not just to your family, not just to your friends, but the support offered through the Lions Club of Tropical Gardens, through the Cancer Foundation, the Cancer Society. Don't ever be ashamed to reach out and ask for help, because it's not easy. It's not easy, but you got this. As long as there is life, there is hope.
All right, Stephanie, thank you so much for joining us.
You're very welcome. Thank you for having me.
Okay, so Maxine, I want you to begin by telling us a little bit about Breast Cancer Awareness Month as it relates to the Lions Club of Tropical Gardens and some of the work that you do.
Okay, thank you for having me. Before I go into saying what the club does, I am the chairperson for this year's Breast Cancer Awareness, and this is our 23rd year in doing breast cancer awareness for the community. We run this program initially through Brenda Tibbetts-Lund, who gave her all to ensure that the club continue on a mantra of helping persons within the community. Now, given the impact of COVID and how things changed, usually we are out there doing our run walks. This year we did not do a run walk, we decided to do a step challenge. And that step challenge is for 1 whole month. So we started out on the 1st of October. Persons were encouraged to register through Cayman Active, and once they were registered, then they would get a fitness tracker, or if they so choose to use their Fitnet or Fitbits, they could register. So our fundraiser, this activity is really sponsored in part by Breast Cancer Foundation. So through Brenda Tibbetts-Lund, so the step challenge this year, instead of a run walk, we've branded it Brenda Tibbetts-Lund 1 month long step challenge. And it's surprising that although we started in October, 1st of October, persons are still registering and taking part. So I implore the Cayman community to continue to do that. So that is what we're doing throughout the month of October instead of doing our run walk. We also have our pink shop open. And our pink shop, we sell items that goes towards purchasing mammogram vouchers. So the money from that goes towards purchasing mammogram vouchers for the community. We not only have the pink shop open, we will also have a distribution of mammogram vouchers at our Lions Den. And the Lions Den is located at 522 Shedden Road, right across from Napa, right next door to Mango Tree Restaurant. Come on in, we are open 11 a.m. to 2 p.m. Monday to Thursdays, 4:30 p.m. to 6:30 p.m. Mondays to Thursdays, and on Saturdays, 11 to 3. So don't miss that. Ladies, take the early detection test, come on out and get your vouchers. Now, we also have, during the month, we are going to have one awareness meeting at the Lions Center. That will be on the 29th of October. And we're encouraging persons to come on out and get educated. Because as we heard earlier from Dr. Hubday, early detection saves lives. And that's, in that forum, women will be able to ask questions, also men. Ask the questions that you need to ask, and you'll get the answers that you so wish to obtain. So during the month of October, there is also Eclipse. Eclipse is one of our partners, and Eclipse is doing a month-long program. Just go on out and see them. They have t-shirts for sale, and also I think they are doing a cut-a-thon, but it's by donation. So it all depends on what you choose to do. We also have Semina's, who's always partnering with us. So I think Semina's event will be 1 month long as well. So go on out and see them. We also have CUC on board with us this year. And what CUC has decided to do is just take your photograph wearing pink and share it on their hashtag. Now, all that information is available on our website at Tropical Gardens, Lions Club of Tropical Gardens.com. We are on Facebook. Once you go onto Facebook, you will see us there, and you just put your photograph. We will share the photograph with CUC. So look for the information again on our Facebook page, and we will be able to get as much sponsorship we need from the public. Thank you.
Okay, Maxine, thank you very much.
Thank you.